invite Dr. Rajashekar from Bangalore, who will be talking on the EDOF lenses, the new generation enhanced monofocal and multifocal lenses.
Thank you, sir. Respected Chair, Dr. Titial, Dr. Sanjay, and dear colleagues. So, in this video, I will not be showing you any videos of surgeries. It's a small change, but I may take you back to your school days of physics. So, so absolutely no financial interest in this. So, what are EDOF lenses? So, these are the lenses which can give focused image, the clear image over a range of distance. So, that's far, intermediate and near. So, even the trifocals and all these things, or even the wavefront based EDOF lenses, they come under the category of extended depth of focus lenses. What is the context in which we are talking? So, here we have an eye in which the crystalline lens may get opacified and we may have to remove that. So, we are speaking in the context of when we are going to replace that, what all functionalities of the normal crystalline lens we can bring back in the eye. So, crystalline lens has the dynamic ability to focus at various distances, and when it is focusing at a particular distance, there is also an image of the object that is in front and behind it also, which aids in the overall depth perception as well as stereopsis. So, here if you carefully look at the diagram, when the eye is focusing for near, even the pupil is changing. So, we keep saying the design of the body is so fantastic. So, when we try to see near, one of the components of accommodation is meiosis. So, that small pupil enhances the quality of vision as well as depth perception. This is one of the features that naturally happen. This is just to say how a convex lens focuses. The light rays, parallel light rays that come, they get focused to a point. This is what exactly the replacement we are going to give. And if you see the same convex lens in the previous diagram, it focused, this is a target which came from a particular point. Now, if you take...
This is the convex lens or the aspheric lens?
No, the general convex lens.
The convex
Just
lens will not focus at one point, no?
Yeah, this is taken as an ideal convex lens with one particular point of a small size, like physics point of view, not from the eye. Huh? So, it's supposed to have same power all over. No? It's an ideal kind of a thing. And then here, such convex lens with a fixed power, then if this is the object S, it makes a clear image at D. But what is S1, which is far away, may not come to the same point. So, it will come to a different point that's in front, and this another point which is ahead of this will come to a more distant point. That means if this is retina, some images will get focused at different points. So, that means it's not having a clear image of all the distances when it is focused at one point. While we replace the crystalline lens, we will be missing the dynamic range of focus. So, this is a limitation with which we are working, and constantly while we are saying that cataract surgery is very well advanced, we are also trying to say that trying to improve on the quality of lenses, and hence you keep seeing every other lens coming now and then. That's because the existing ones are not ideal, they are not comparable. How to overcome this loss of dynamic range of focus? Here we need to tweak the IOL designs and play with properties of light. So, ideal replacement is another crystalline lens. While we are still not at it, if you take this first image, that is where one lens will focus here. Now, if the same power is given, it can focus the far objects, but when the same lens comes to the near objects, it's out of focus. So, this is the limitation with which we are working. Now, how to overcome? So, if you are clear at this point, this is a simple one. Now, we will go one by one. See here, instead of a lens, I have just written a box, thinking, it may not be an ideal convex lens, but a tweaked one. Here in this case, the parallel rays, the D rays are coming to a focus at this point. The intermediate ones, which come from around 60 inches or something like that, they come to a focus somewhere here. And the nearer ones, they get focused very far. So this is the situation with normal lenses. Now, by tweaking this, suppose we achieve something where these lenses, after going through this magical box, they get bent little more, and this distance one, this gets bent little further away. We are just talking ideal situation, trying to overcome the limitation. Then we will be able to bring this point close to this and this point close to this. These 3 points will come closer. Now, is it possible? Can we bend the light rays? Then can we diverge these light rays is the question. Now we will look at various properties of the light rays. So this is the, by doing this kind of a tweaking, this is what we are trying to achieve, the nearness of these 3. By this what happens, the quality of image from the distance, intermediate and near, all will be closer to retina, all will be nearly focused. An ideal situation is that coming to a very sharp focus and being in one line. But the ideal is difficult here, but it will come to a focus in a way that it has some kind of a tunnel kind of a thing will come. This channel will have width and also length. Suppose if that width is very low, that means all these light rays are converging here and becoming a line like, that means it's very, very sharp vision. Suppose if this length, this far and near and intermediate one, this is wide enough here, that means it gives a long range of vision. So that is a kind of one thing where we tweak these light rays and then try to achieve both sharpness as well as range of vision. Now another point comes. What about the quantity of light? Suppose 100x light is coming in. Now when it gets divided here, so will all the light come to the same focus, that is into the channel that we are talking, or some of the light is outside that? So in an ideal situation, we want all the 100 light to come into the channel, this kind of a channel here. But in reality, it doesn't happen. Some amount of light will go away. So now you have various lenses which try to bring in the light rays into one channel. They also try to bring all the light, but it failed. So now we need to see what are the various designs and how it happens. The various challenges we face are in the width of this tunnel. The width of tunnel is very narrow. You get excellent acuity of vision at distance, intermediate and near. If the length of this tunnel is long, you get a long range from say 30 centimeters to far away. But various lenses stop at various points. Now the light outside this, why are we concerned with the light outside this? Why are we concerned with the width of this tunnel? If the light outside is more, it causes halos and blur, and also it reduces the contrast sensitivity. So each lens has a different kind of approach. Now this would be the ideal lens. It will give all the near, intermediate and distance into one focus, and after the light ray bends, it doesn't diverge away, it goes in this kind of a channel. That's difficult because light doesn't behave like that. Then what are the various attempts? One is small aperture IOL, spherical aberration IOL, diffraction IOLs, and wavefront shaping of the optical principle. In small aperture IOLs, you just reduce the aperture and it will go. In spherical aberration IOLs, the peripheral light rays, they bend more than the central one, and hence it acts like a lens with a different focal lengths, and it can bring in a focus. But there will be challenges of halos and blur there. Then comes the diffractive set of lenses. These are one of the common ones which are used. Here you have these step-like things. Diffraction is one property of light where when light travels in straight lines, but when it goes through edges, some amount of bending of light rays happen. That's the diffraction. That property is used as an advantage here by creating those edges and making the light ray bend to our advantage. So in these diffraction, you have the height of this and the area here. The height here gives the near focus. That is where the light ray bends. The more taller it is, will give you more addition, near addition. And the more area here, this area and this area are important because that is where the light division happens. How much for near and how much for distance. So that's how the diffractive lenses are designed. And here again, halo effect is one issue. The edge effects that come are another issue. Another way of handling this thing is using the wavefront shaping of the light. I'll just take 2 minutes, 1 minute or so. This is where this is how the light goes. It has a Gaussian profile. In industries, this is used to make cutting in the iron. If you use this laser beam, this is how it cuts the iron piece. By putting a beam reshaper, this Gaussian beam is reshaped into this kind, and this kind of a punched out cut is possible in industries. Using this principle into eye, so this beam is reshaped in a way that it goes into this tunnel. By delaying this and converging this more, by reshaping the image. This gives this kind of a profile wherein though we are not able to get a thin line, but we are able to get narrow width and a long tunnel, long channel of light. This is where we are going to achieve in the current day wavefront surface modified IOLs. Here the advantage is the light distribution is better, light quality is better, and the range is continuous. Halos are less or nil. So this is, you can go through that. This takes time to analyze. There is one diagram which compares how each IOL behaves. And there are guidelines to classify intraocular lenses as which are EDOF category and which are not EDOF category. So lack of time, I am not going into that. And one small word, whenever these lenses come, kindly go through the manufacturer's guidelines. Current guidelines are it can't be used in children, and there are some contraindications also written, which your representative may not tell you. And if you end up using them and later on, if it doesn't commensurate with the recommendations, things may go wrong. Thank you very much. Thank you. Sorry for overshooting, you know.
That was really good. Yeah, sorry.
Sorry for overshooting, you know, it was physics, so I had to go a little slow.
Thank you so much, Dr. Shekhar. I think the most important, sorry, I always have to adjust the microphone to the height of mine. So thank you so much you rightly said, I think you concluded with a very important message that there are a few things that the manufacturers do not tell you and you should always keep in mind. So in my experience, what they also do not tell you and you also should keep in mind is there are two things. One of the things is out of the three principles that you just described, the diffractive design does not strictly come under the EDOF category. So let's just concentrate on the wavefront tweaking and the spherical aberration add-on. Out of these two, the photic phenomenon in my experience is more with the spherical aberration add-on type of lenses. So you have to be careful. The wavefront tweaking does reduce this photic phenomenon to a considerable extent, but I do differ greatly from what they have been telling us over the years, is that the EDOF lenses of whatever design they do have a central bullseye change in whatever manner. And they are not, I repeat, they are not resistant to angle alpha. So if that central bullseye, wherever the change is made, is not very small and it doesn't occupy the center of the pupil, then you would have very disturbing photic phenomenon and does extrapolate to patients' discomfort and dissatisfaction. So they are not resistant to angle alpha. I'm still trying to study what should be an ideal margin or a forgivable margin for this. But I can't tell you the figure right now, but for me, the cutoff is 0.5. Beyond 0.5, I do not put EDOF. Angle alpha, 0.5. Beyond that, I do not put EDOF because I've burnt my fingers in a couple of cases doing that. Thank you so much, Dr.